Hi, everybody. Hope everybody's having a great day today. I know there's a lot going on in our world, but I've been talking for the past several videos about what true health is, what health really is all about. And we've been talking about how it's not just physically how we feel, it's not just the presence or absence of symptoms. It's really how well we're doing physically, mentally, emotionally, socially, spiritually, financially. It's our overall well-being. And so I came across a couple of cover photos from the new Cosmopolitan magazine, and I don't read that magazine. I don't know anything about it, but these cover photos have become pretty popular. I've seen them posted everywhere, and here's one of them. It basically says, "This is healthy. 11 women on why wellness doesn't have to be one size fits all." I agree that it doesn't have to be one size fits all. Here's another one of the photos here. And again, same topic that we're looking at here. And I think it's ironic that we see something that we're trying to do is say, you know what, this is really, really common. In the United States, we lead the world in obesity. And so oftentimes we tend to say, okay, if something is common, we call it normal. And I'm here to tell you that it's not the same thing. Normal is being fit, active, energetic, and resistant to disease. We've been going through for the last 9 months the whole COVID issue that's going on, and guess who is most at risk for having severe complications, potentially life-threatening, even death from COVID? It's going to be people who are obese, people with metabolic disease and disorders. And so I would be quick to say we need to calling what's common as normal. I was talking to somebody yesterday and we were kind of joking around saying, I'm closer to 60 now than I am to 50. And I'm really excited about that because here in the United States, we have a 1 in 1,000 chance statistically of making it to the age of 60 without having chronic disease, chronic health problems, and having to take chronic medication. I know that I'm more than 1 in 1,000, but I'm going to be that 1 in 1,000, and that I haven't actually taken any medication since 1986. Somehow I've survived, and it's because I don't see health as just being common. I see health as a lifestyle. I see health as something where if we put the right energy in, we get the right energy out. It's not on how I feel; it's on what I do day in, day out to take and steward this body, this life that I've been given. Another picture I came across as I was going through things today is actually from the Longmont Times Call, and it's kids going back to live school. And I brought this picture up because you know what? Just as this isn't healthy, neither is this. This is not what being healthy is all about. And I mean that in a lot of different ways, is that we've made that normal now. We look at this and we celebrate this. Yay, the kids go back to school. But guess what? This isn't going back to living healthy. This isn't going back to embracing what we're supposed to be doing. Again, it's calling what is normal, or calling what is common as normal. And that's not right. And I want to attach that to this study as well. This is a study that I referred to a couple of days ago that came out of Germany looking at over 23,000 children. And what they did was they looked at what kind of effects wearing a mask over the past few months has had on the health of these children. And so here are some of the listed complications or health problems that came up as they were interviewing the physicians and the parents of these children. And these are things that have shown up since they've been wearing masks that they weren't having problems with prior to wearing masks. We've got headaches, we've got concentration difficulties, discomfort, impairment in learning, drowsiness, tiredness, tightness under the mask, feeling of shortness of breath, dizziness, dry neck, not sure what dry neck is, syncope, that's going to be dizziness or imbalance issues that's going on, feeling lightheaded, unwillingness to move, unwillingness to play, itching in the nose, nausea, feeling of weakness, abdominal pain, accelerated respiration, disease feeling, tightness in the chest, flickering eyes, loss of appetite, tachycardia, which is going to be an increased heart rate, noise in the ears, short-term impairment of consciousness, fainting spells, vomiting, children being more irritated than normal, children that are less cheerful. The child no longer wants to go to school or to kindergarten. Child is more restless than usual. And so you look at this and you kind of go, these are things that have happened since this has become common. But this is not normal. This is not healthy. And we need to take back what health is really all about. And it comes back to this, is that health is a lifestyle. Health isn't how you feel. You can feel crummy and be expressing health. And we're going to get into that in more detail. You can feel fine, and you can be a day away from having a massive heart attack or being diagnosed with cancer that's been growing in your body for decades. Health is a lifestyle. Health is nurturing and stewarding yourself physically, mentally, emotionally, spiritually, socially. And it really consists of a few things. It's how well are we feeding ourselves? How well am I feeding my mind, my spirit, my body? How well am I exercising my mind, my spirit, my body? How well am I resting my mind, my spirit, my body? And as I take and I put together a lifestyle that takes and honors these virtues as something that only I can take the responsibility for, this is where I get to start entering into experience the benefits and the joys of health. I get to be free from the fear of sickness and disease. And so stay tuned. We're going to be really digging into this deeper. And over the course of 2021, my hope is that we can actually create a movement where we've seen in the last 9 months just this wave of fear and wave of really kind of suppressing our identity, suppressing our strengths. I want to see that pushed out, and I want to see a wave of life, vitality, being fully alive, seeing that we've got passion that's being returned to our lives. So stick with me. Be sure to share this with as many people as you can. This is important information. Until next time, this is Dr. Zach. God bless you guys, and make today great.